Gerda noted that in a research study in Stockholm, Sweden, in 2020, researchers screened 8,899 randomly selected 75-year-olds living in Stockholm without previously known atrial fibrillation, AF, for AF using home-based short-term ambulatory 1-lead ECG measurements 2 to 4 times a day for 14 days. Screenings were carried out in 2012 to 2013 and 2016 to 2018. Researchers used generalized estimating equations to quantify the association between PM2.5, obtained from a fixed monitoring station, and risk of AF onset among participants with AF observed during the screening period, adjusting for temperature, relative humidity, and temporal factors. Researchers explored potential susceptible subgroups. The researchers noted the most prominent association between PM2.5 exposure and increased risk for AF episode was found in a 48 to 72-hour window. Their findings bolster evidence that AF may be triggered by short-term increases in air pollution, even at levels well below the new World Health Organization air quality guidelines of 15 micrograms per meter cubed for daily PM2.5 exposure and the annual mean levels of 5 micrograms per meter cubed. Given the high prevalence of AF and the universal exposure to air pollution, this has a potential impact on public health and highlights the need for further population-level approaches for air pollution reduction and primary prevention of disease, the researchers concluded.